Hello friends, this is the second lecture of adrenal medulla, and in this lecture we are going to discuss about the effect of the catecholamines, and along with it we are going to discuss a small portion of a sympathetic stimulation, that is the part of the autonomic nervous system. Now you guys already know there are 7 to 8 lectures are already available in our YouTube channel, so we are not going to cover the entire ANS, we are just going to cover a small portion of sympathetic stimulation. So let's get started. Now, as far as the autonomic nervous system is concerned, is basically designed to maintain a life, or mainly developed to live in a jungle environment. Alright. Now, in jungle there are two things that you need to do. One is the fight. Either you have to fight, and if there is no fight, then you have to relax and rest, right? So to sustain a life in jungle environment, you need to either fight or you need to rest. So autonomic nervous system is basically have a two subtype. One is the sympathetic stimulation. That sympathetic stimulation is designed for flight and fight response. If enemy is stronger than you, then you have to flight from the site, and if enemy is not that much of stronger, then you have to fight with the enemy, right? So sympathetic nervous system will design for that fight and flight response. And in other terms, the parasympathetic nervous system is basically designed for rest and digest. Remember the term rest and digest. So when the animal is rest and digesting, the parasympathetic nervous system is active. When animal is in fight or in flight or in stress, in our world we have we are not going to flight or fight with any animals or our enemy. In human being, the sympathetic system will be overactive in emergency situation, basically in stressful condition, and during physical overactivity. In that condition, the sympathetic system will be active. Now, what are the effect of the sympathetic stimulation? Now, whenever the sympathetic stimulation occur, it will leads to release of catecholamines, that is norepinephrine and epinephrine. Most of the time, epinephrine 80% is basically from the adrenal medulla, norepinephrine from the postganglionic sympathetic fiber. Now, what are the effect of norepinephrine and epinephrine? So, to understand that, see, during fight or flight, it stimulates the tissue. Norepinephrine and epinephrine, they basically stimulate the tissue that are helpful to fight stress. Got it? So whatever the tissue in our body that helps in a emergency situation. Let's take a situation that you are going in a road, you are walking in the road and some dog approach you and the dog start barking. That is the emergency situation for you guys, and you have to either run or you have to fight to that dog, right? So in that condition, it stimulates the tissue that are very helpful to fight that stress, and sympathetic stimulation will inhibit the tissue that are not helpful to fight stress. It is the tissue that is not used in emergency, right? अगर आप के पीछे कोई कुत्ता पड़ा है तो आपको पहले वहाँ से भागना ज़्यादा ज़रूरी है, आपके डाइजेशन से भी ज़्यादा ज़रूरी, राइट? तो आप डाइजेशन जो पोर्शन होगा वो इनहिबिट होगा, और स्केलेटल मसल्स जो आपको भागने के लिए काम आएंगे वो स्टिमुलेट हो जाएंगे. सो एनी टिश्यू दैट वेरी हेल्पफुल in that stressful condition, it going to stimulate that particular tissue, and it inhibit the tissue that is not helpful in fight the stress, right? So that type of changes will take place in our body, and that type of changes, it is known as flight or flight response. Got it? Now we are going to understand different kind of changes that will take place in our body, starting from the top. What are the changes will take place in our head? Basically the changes will take place in hair, right? So in emergency situation, in stressful condition, when we have a fear, then our hair will be stand up. Now this changes is very helpful in animal. It makes the bigger appearance. You can see in this gorilla, this gorilla is in fight, so there is an emergency situation. See, the hair over the gorilla's body is stand up, right? It makes the appearance of that gorilla very big. So similar type of changes will take place in human, but it is not that much of effective and not that much of pronounced. Our hand will be stand up. Now how our hand will be erect? Because of the contraction of the muscle that is situated over here, that is erector pili muscle. Contraction of this erector pili muscle will leads to that kind of goosebumps, right? So basically erector pili muscle get contracted. So I told you in our previous lecture that any tissue that is stimulated have a alpha 1 or beta 1 receptor, and any tissue that get inhibited have a alpha 2 or beta 2 receptor. Got it? This formula is correct for about 95 to 98% of the cases. So remember that any tissue that are stimulated by sympathetic nervous system by adrenergic receptor have a alpha 1 and alpha 1 and beta 1, and the tissue that get inhibited by sympathetic stimulation have a adrenergic receptor set of beta 2 and alpha 2. So in this case, this erector pili muscle have a alpha 1 receptor. So in this way you can easily remember the receptor, you can easily remember the effect of the sympathetic stimulation and the effect of parasympathetic stimulation by just comparing that person is in the emergency situation, in fight or flight response, or in any stressful condition. So second change is, if we go down, then the eyes will come. What are the changes will take place in eyes? So you see there are two animals are fighting. So what changes will take place in that animal in fight situation? What happens to the pupil? So pupil has to dilate. Why pupil has to dilate? So maximum amount of light will enter inside animals or person's eye, right? What is the benefit of that? So person can see in a dim light also. So more amount of light, it can give you a clear vision, as you guys already know. So in order to dilate the pupil, what you have to do? You have to contract the pupillary dilator muscle. You have to dilate the pupillary. You have to contract the pupillary dilator muscle. So pupillary dilator muscle having a alpha 1 receptor over it. Correct? Why pupil dilate in sympathetic stimulation? By during sympathetic stimulation, during fight of a two animal, if the pupil dilate, then there are maximum amount of light will enter into the eye, so person can see in a clear fashion, right? So pupillary dilator muscle should be contracted, and that pupillary dilator muscle have a alpha 1 receptor. Now what happens to the accommodation reflex? Now as far as the accommodation reflex is concerned, animal should focus. Animal has a clear vision about far vision. The animal or the competitor that is situated far from him, animal has a clear vision of that his enemy. So eyes has to accommodate for far vision, right? So in order to see far, lens has to be flat. So remember this mnemonics: far, flat, f is equal to f. To see far, lens has to be flat. So in order to make a lens flat, ciliary muscle need to relax, right? So in order to you guys already know the actual anatomy of the eye from the spatial sense lectures, where the ciliary muscle is situated, what happens when the ciliary muscle contract, what happens when the ciliary muscle relax. So basically, accommodation, to make a lens flat, ciliary muscle needs to relax, right? So what are the type of the receptor should be taking present over the ciliary muscle? Yes, alpha 2 or beta 2. In our case, there is beta 2 receptor. Beta 2 receptor will present over the ciliary muscle. Now if you go little bit of down, then what are the changes will take place in the respiratory system? So in fight, the animal needs more amount of air, right? Animal needs more amount of air, so they are basically increase respiratory rate. This is about the rate. Now what happens to the bronchi? Now in order to make more amount of air available at the alveolar site, the bronchi should be relaxed. So there is basically relaxation of the bronchial smooth muscle. So in order to relax bronchial smooth muscle, there is a which receptor is supposed to present over the bronchial smooth muscle? Yes, alpha 2 or beta 2. In our case it is beta 2. See, alpha 2 receptor is basically present over the presynaptic terminal, right, that I told you already in our previous lecture. So most of the time in relaxation or in inhibition cases, beta 2 receptor is present. Alpha 2 receptor is only present over the presynaptic terminal and platelets, in some case in GIT, but most of the time in inhibitory function or in relaxation function, beta 2 receptor is present. So ciliary muscle, once it relaxes, it has a beta 2 receptor. Bronchial smooth muscle, they are relaxed, they have a beta 2 receptor. Now just adjacent to the lungs there are heart. Now what are the changes taking place in the heart? So during the fight of the two animal has to get more amount of blood, right? So heart supposed to pump more. So in pumping, so we have to stimulate certain things, we have to stimulate the heart. So over the heart there is a beta 1 receptor. So once the beta 1 receptor gets stimulated, what will it leads? It leads to overfire of the SN node. Once the SN node overfire, it generates more amount of the impulse. It has a positive chronotropic action. So basically there is increased heart rate. So if you go downward from SN node, the impulse come to the AV node, and now AV node become overactive, and it will cause the increased conduction of the impulse through the AV node. So that it is known as dromotropic action, increased conduction velocity. Now as impulse go downward into the ventricle start contracting more vigorously. So very basically there is increased force of contraction, that is known as positive inotropic action. Now these are the changes will take place in the heart by beta 1 receptor. This is all about the changes in the heart. Now what are the changes will take place in blood pressure? Now the changes that take place in the blood pressure are little bit of tricky. So if possible write it down somewhere, because the slide 1 or 2 slide from now on I take from the pharmacology book. So it little bit of complicated, but it is helpful in second year also. So try to note it down somewhere. So let's get the changes that is take place in the blood pressure. Now as far as the adrenaline is concerned or epinephrine is concerned, epinephrine will work via alpha 1 plus alpha 2 plus beta 1 plus beta 2 action over the blood pressure. So and also has a weak beta 3 action. Now as you guys already know, beta 3 receptor is basically present over the adipose tissue. So that's not in our case. We are not going to discuss in the beta 3 receptor. Now as far as the norepinephrine or noradrenaline is concerned, it has a alpha 1, alpha 2, beta 1 and beta 3 action. It does not have a beta 2 action. Norepinephrine does not have a beta 2 action. And the other one that is covered in pharmacology is the synthetic catecholamine or exogenous catecholamine, that is isoprenaline. Now here's the thing, isoprenaline has a no alpha action at all. It has only beta action, beta 1, beta 2 plus beta 3 and no alpha action. Now write it down somewhere. Adrenaline will work via alpha 1, alpha 2, beta 1 and beta 2 receptor. Noradrenaline has a no beta 2 action and isoprenaline has a no alpha action. So let's discuss the changes one by one, the effect of adrenaline. Now here's the thing, if you inject the adrenaline slowly in slow IV infusion, or if you give subcutaneous injection, in that case beta 2 receptor is more sensitive to alpha 1 receptor. Remember that. In slow infusion, if you give adrenaline slowly in that particular dose, beta 2 receptor is more sensitive than the alpha 1 receptor. Now what is the effect of beta 2 receptor? It is going to relax certain things, right? Beta 2 receptor is going to relax the vessels. So more pronounced beta 2 effect will ultimately dilate the blood vessel, has a vasodilator effect. So once the vessel get dilate, what happens to the peripheral resistance? Once the vessel get dilate, the blood that is flown through that vessel will experience less amount of the resistance, right? So basically less amount of the peripheral resistance. As the peripheral resistance decrease, ultimately it will decrease the diastolic blood pressure. So in slow IV infusion of the adrenaline, it causes decrease in the diastolic blood pressure. Now adrenaline also has a beta 1 stimulatory action, and we already know what is the effect of the beta 1 stimulation in our previous slide. Beta 1 stimulation will leads to increased heart rate. So whenever there is increased heart rate, there is increased systolic blood pressure. Now you guys see that in slow infusion of the adrenaline, diastolic blood pressure get decreased and systolic blood pressure get increased by working via different type of the receptor. Now in this both the cases, what happens to the pulse pressure? So what is pulse pressure? Pulse pressure is equal to systolic minus diastolic blood pressure. Now in our case, systolic blood pressure is increased, diastolic blood pressure get decreased. So what happens to the pulse pressure? Pulse pressure is going to increase. Now what happens if we inject adrenaline rapidly? What happens with the rapid IV injection? Now if you inject the adrenaline very rapidly, now in that case alpha 1 action will be more pronounced than beta 2 action. So if the alpha 1 action is more pronounced, then instead of the vasodilatation via beta 2 receptor, the alpha 1 receptor causes the vasoconstriction. So what will happen? Vasoconstriction will lead to increased peripheral resistance and increased diastolic blood pressure. So if you rapidly inject the adrenaline via alpha 1 action, it causes increased diastolic blood pressure, and beta 1 stimulation is remain as it is. So what happens once you inject the adrenaline in rapid injection? There is increase both systolic as well as diastolic blood pressure. This is the difference between the injecting the adrenaline. It is a little bit of confusing, but try to remember it. Slow IV infusion, beta 2 action is more pronounced than alpha 1 action, and it leads to decreased diastolic and increased systolic blood pressure. In this slide I forget to write it down over here alpha 1, instead I just mentioned alpha, but it is alpha 1. So in rapid IV injection, alpha 1 action is more pronounced. It will lead to vasoconstriction and it causes increased diastolic as well as systolic blood pressure. And what happens to the mean blood pressure? The mean blood pressure is basically gradually increase. Now let's see the effect of noradrenaline and isoprenaline over the blood pressure. Now effect of noradrenaline. Now if you remember that noradrenaline has no beta 2 action at all, so it fails to dilate blood vessels, so it not causes vasodilatation, and beta 1 stimulation will ultimately increase the systolic blood pressure, and alpha 1 stimulation will ultimately causes vasoconstriction, and it increase the peripheral resistance and ultimately increase the diastolic blood pressure. Is simple as it is. Norepinephrine has no beta 2 action, so no vasodilatation. Beta 1 action will lead to increased systolic blood pressure, and alpha 1 action will lead to increased diastolic blood pressure. Now what is the effect of isoprenaline? Now here's the thing. Isoprenaline has no alpha action at all. So beta 1 stimulation as it is, it will increase the systolic blood pressure, and via beta 2 stimulation it causes vasodilatation, then it causes decreased peripheral resistance and ultimately decreased diastolic blood pressure. So isoprenaline has the same effect as we inject the epinephrine slowly. Got it? Norepinephrine will increase systolic as well as diastolic blood pressure, while isoprenaline has a increased systolic while decreased diastolic blood pressure. I know it is little bit of confusing, but try to remember it, write it down somewhere. It will be helpful in remembering the action of adrenaline and noradrenaline in pharmacology also. Now what are the changes will take place? This is all about the blood pressure. Now changes take place in different blood flow. Now in emergency situation, in fighting situation, once the animal get into the fight, it is not important then the blood flow, where is the blood flow should increase and where the blood flow is should decrease. कहाँ पे ब्लड फ्लो ज़्यादा हमको चाहिए फाइटिंग सिचुएशन में और कहाँ पे हमको कम चाहिए. तो आप देख सकते हैं कि स्किन में जो ब्लड फ्लो है वो उसका काम होता है बेसिकली थर्मो रेगुलेशन. सो अगर आप फाइट में हैं तो थर्मो रेगुलेशन इज़ नॉट दैट मच ऑफ इम्पोर्टेंट. आपको ब्लड फ्लो कहाँ पे ज़्यादा चाहिए, आपको ब्लड फ्लो ज़्यादा चाहिए स्केलेटल मसल पे, ताकि आप फाइट ठीक से कर सके या फिर ठीक से भाग सके. सो ड्यूरिंग फाइट एंड फ्लाइट ब्लड फ्लो स्किन में ज़्यादा नहीं होना चाहिए. तो क्या होगा स्किन के ब्लड फ्लो के साथ, ब्लड फ्लो टू द स्किन विल डिक्रीज, राइट. सो ब्लड फ्लो टू द स्किन इज will decrease in sympathetic stimulation. How the blood flow to skin will decrease? Via constriction of a vessel. Now in constriction of the vessel, so it has a alpha 1 receptor in this blood smooth muscle of the blood vessel. Now what happens to the blood flow to the GIT? Now GIT में जो blood flow है वो किसके काम आता है, क्योंकि हम ठीक तरह से ब्लड सिक्रीशन, GI सिक्रीशन ठीक से हो सके, ठीक से एब्जॉर्प्शन डाइजेशन हो सके, राइट. बट अब एनिमल जब फाइट कर रहा है तो उसको डाइजेशन की ज़्यादा ज़रूरत नहीं है. अभी डाइजेशन थोड़ी देर बाद होगा तो चलेगा, लेकिन अब हमको चाहिए ज़्यादा से ज़्यादा ब्लड स्केलेटल मसल पे कौन जाए. तो हम क्या करेंगे, तो सिंपैथेटिक स्टिमुलेशन क्या करेगा, सारे के सारे ब्लड को स्केलेटल मसल पे डाइवर्ट कर देगा. तो ब्लड फ्लो टू GIT गेट डिक्रीज. टू डिक्रीज द ब्लड फ्लो टू GIT, the constriction of the vessel should occur, right. So the constriction of the vessel will ultimately by stimulation of the alpha 1 receptor. In same fashion, what happens to the blood flow to the kidney? Now why we need blood flow to the kidney? To basically to filtrate the blood, right. We have to just remove the excretory products. So now during the fight the excretion is not that much of important, right. Filtration of the blood will not that much of important as the blood flow to the skeletal muscle. So blood flow to the kidney will also decrease, right. Filtration excretion of the metabolic waste product वो बाद में भी हो सकता है. राइट नाउ हमको ज़्यादा से ज़्यादा ब्लड स्केलेटल मसल पे चाहिए, तो जो भी ब्लड किडनी में जाएगा वो भी डाइवर्ट हो जाएगा स्केलेटल मसल में. तो कौन कौन से ब्लड डाइवर्ट हो रहे हैं स्केलेटल मसल में? स्किन में जो जा रहा है वो ब्लड डाइवर्ट हो रहा है, GIT में जा रहा है वो भी ब्लड डाइवर्ट हो रहा है, एंड किडनी में जा रहा है. वो तीनों के तीनों जो ब्लड जनरली इसमें जाते हैं वो सारे के सारे ब्लड डाइवर्ट होकर स्केलेटल मसल में जाएंगे. सो व्हाट हैपन्स टू द ब्लड फ्लो टू द किडनी? बेसिकली डिक्रीज वाया कॉन्स्ट्रिक्शन ऑफ द वेसल. And what are the receptor that is present over the kidney? Is alpha 1 receptor, because alpha 1 and beta 1 are basically designed to stimulate reaction. Beta 1 receptor is already present over the heart, and remaining portion will be covered by alpha 1 receptor. It is as simple as it is. Now blood flow to the skeletal muscle. This is the main hero in our discussion. What happens to the blood flow to the skeletal muscle? Blood flow to the skeletal muscle is eventually increased because of the diversion of all the blood and dilatation of the vessel that supply the skeletal muscle. So what are the receptor present over the skeletal muscle? In this case we need to relax certain things. So there is a alpha 2 or beta 2 receptor. Now I told you earlier that alpha 2 receptor is basically present over the presynaptic membrane of the nerve terminals. So in this case beta 2 receptor will be present. Got it? This is all about the blood flow to skin, GIT, kidney and skeletal muscle. Now the most important one, what happens to the blood flow to heart and brain? What happens to the coronary circulation and what happens to the cerebral circulation? Now blood flow to the heart is known as coronary circulation, and blood flow to the brain will known as cerebral circulation. Now here's the beauty, both the coronary and cerebral blood vessel has an equal number of alpha 1 and beta 2 receptor. So they get equally contracted and equally dilated, so there are basically no more changes in the blood flow, and basically both this blood flow will regulate automatically, that is known as auto regulation. Now this auto regulation is basically local metabolic product regulated, right? If the brain and heart require more amount of blood, that will if they work more, they produce more amount of the local metabolites. That local metabolites will eventually dilate the blood vessel via secreting the local metabolites, and it will eventually increase the blood flow, right? This is all about the blood flow concept. Now what happens to the GIT? What happens to person's GIT? See, blood flow supposed to decrease, right? So for that there is a decreased blood flow, constriction of the blood vessel, ultimately via alpha 1 receptor. What happens to the peristalsis? Now I told you earlier, when animal is in fight or flight, then peristalsis is not important, right? The important thing is to fight or flight. So peristalsis will hold break, so peristalsis will decrease, ultimately causes by relaxation of the smooth muscle of the GIT, and this will be done by beta 2 receptor. Now what happens to the sphincter? Sphincter supposed to constrict, right? Why? We do not need to increase motility of the GIT. We do not want to divert the blood or divert our energy to GIT to just mobilize the food product in our GI tract. So sphincter is supposed to get constricted, and that so to stimulate certain things it has a alpha 1 receptor. And finally, because of decrease in the blood flow to the GIT, GI secretion will decrease. This is all happens to the GIT. You have to just remember one thing: during fight and flight, during that fighting condition, we do not want digestion, right? That time, right? We want our entire blood and our entire focus over the fight and flight. So blood flow to GIT will decrease, motility of the GIT is decrease, secretion of the GIT is decrease, right? आपको खाना पचाना ज़्यादा ज़रूरी नहीं है जब आप फाइट में हैं, आपको ज़्यादा ज़रूरी है फाइट में इन्वॉल्व रहना, राइट? So at that time, during stressful condition in fight and flight, the more important is to get in fight and flight. You have to get more concentrated in fight rather than digestion or absorption of the food. So you have to just make that particular changes. So it is very simple to understand. You do not need to mug up all the thing. आपको कुछ भी याद रखने की ज़रूरत नहीं पड़ेगी अगर आप इसको concept wise याद रखेंगे. Now what happens to the urinary bladder? अगेन इट इज़ जस्ट अ कॉमन सेंस. अगर आप फाइट में हैं तो आपका यूरिनेशन ज़्यादा इंपॉर्टेंट है, मिक्चुरेशन ज़्यादा इंपॉर्टेंट है? नहीं है. तो क्या होगा? सिंपैथेटिक स्टिमुलेशन होगा. तो वी डू नॉट नीड टू वॉइड द यूरिन, राइट? यूरिन हम स्टोर कर सकते हैं कुछ देर के लिए जब तक हम फाइट और फ्लाइट में हैं. सो बेसिकली ड्यूरिंग सिंपैथेटिक स्टिमुलेशन अल्टीमेटली देयर इज अ स्टोर ऑफ द यूरिन विल नॉट पास, while on other case parasympathetic stimulation will leads to void the urine. Alright, so in order to store the urine, what would be happens to the detrusor muscle that is situated over the uterine bladder, this urinary bladder? So detrusor muscle supposed to get relaxed. In order to relax the detrusor muscle, they have beta 2 stimulation, beta 2 receptor. Now again, to store the urine, what happens to the sphincter that is present over there? In order to store the urine, sphincter is supposed to constrict. So to constrict the sphincter, it has a alpha 1 receptor, right? So in fight and flight, we do not need to void the urine to micturate, rather we want to store the urine in flight, और वहाँ से भाग जाना ज़्यादा ज़रूरी है वहाँ पे मिक्चुरेट करने से, राइट? सो क्या करेंगे? मोस्टली सिंपैथेटिक स्टिमुलेशन क्या करेगा? वो स्टोर करेगा यूरिन को. तो स्टोर करने के लिए हमको डेट्रूजर मसल रिलैक्स चाहिए, स्फिंक्टर कॉन्स्ट्रिक्ट चाहिए. तो कुछ चीज़ें रिलैक्स करने के लिए मोस्टली बीटा 2 रिसेप्टर यूज़ होता है, और कॉन्स्ट्रिक्ट करने के लिए और स्टिमुलेट करने के लिए अल्फा 1 रिसेप्टर स्टिमुलेट होता है. इट इज़ वेरी सिंपल. नाउ व्हाट हैपन्स टू द कार्बोहाइड्रेट मेटाबॉलिज्म? नाउ इन इमरजेंसी सिचुएशन वी नीड मोर अमाउंट ऑफ एनर्जी, सो वी नीड मोर अमाउंट ऑफ फ्यूल. So what catecholamine do? Catecholamine basically increase the blood glucose. How it will increase the blood glucose? It will stimulate the glycogenolysis. It will break down the polymerization of the glucose. It release the glucose and inhibit the glycogen synthesis. It inhibit the glucose polymerization. And as far as the hormone is concerned, catecholamine will stimulate the glucagon and inhibit the insulin. and we know what are the effect of glucagon and what are the effect of insulin, so no need to get into the detail, right? This is how catecholamine eventually leads to increased blood glucose level. It makes sure that glucose in proper amount to utilize, right? Now what happens to the fat metabolism? Now fat is also alternative substance for the energy metabolism, for energy. So free fatty acid is provided as an alternative substance for the fuel. So what catecholamine do? Catecholamine will ultimately increase blood free fatty acid level. Now how catecholamine will increase free fatty acid? That is very easy. The same mechanism will take place as we understand what happens in insulin deficiency, right? In insulin deficiency, there is the activation of the hormone sensitive lipase, right? So basically this same mechanism will be activated by catecholamines. So it increases the release of free fatty acid from the adipose tissue. Now how catecholamine increase free fatty acid from the adipose tissue? By activation of the hormone sensitive lipase. Now hormone sensitive lipase, right? This lipase enzyme is sensitive to the hormone. Which hormone? There are list of the hormone, that's why the particular hormone is not written over here. They just say hormone sensitive lipase. Now this lipase is sensitive to list of the hormone. One is the catecholamine that we are discussing right now. Another hormone is the glucagon. Then next hormone is the glucocorticoids. And then there is a growth hormone. This all the G, growth hormone, glucocorticoids, glucagon, all these three G will eventually activate this hormone sensitive lipase, while on the other hand catecholamine will also activate the hormone sensitive lipase, and now on the other hand the lipoprotein lipase will stimulated by only insulin, right? So once this hormone sensitive lipase is activated, what it will do? It will break the triglyceride that is stored inside the fat cell or adipose cell, and ultimately break the triglyceride into fatty acid and glycerol, and this free fatty acid will ultimately released into the blood, and inside the blood this free fatty acid has a two pathway. It has a two fate. One, either this free fatty acid will converted into the glucose eventually by gluconeogenesis, or this free fatty acid as it is, it will utilize as a fuel. Alright, this is what happens in the fat metabolism. Now let's discuss something about reproduction. What happens to the male reproductive system? Now as far as the male reproductive system is concerned, the erection of a penis is a function of parasympathetic activity. In order to erect penis, parasympathetic activity is supposed to increase, and after that ejaculation is the function of sympathetic activity. Got it? So you see, in fight and flight response there is only sympathetic stimulation will take place. So it's supposed to, during fight, animal supposed to ejaculate the semen, right? But that thing is not important. During the fight, ejaculation is not important. The reproduction is not important at the time of the fight. So nature do a very beautiful thing, that the thing is that normally when erection occurs, then and then sympathetic activity will leads to ejaculation. Got it? Without erection, ejaculation will not take place, no matter how much more amount of sympathetic overflow is there. So this beautiful thing that is done by nature is that once the person in fight or in stressful condition, though sympathetic overflow occurred, but person or that animal is not ejaculate. Though sympathetic activity occurs in in emergency situation, but in absence of the erection, ejaculation will not occur, right? So in order to get ejaculation, animal first erection must be there, and for erection parasympathetic activity is supposed to get high, right? So first parasympathetic activity will increase, it will lead to erection, then parasympathetic activity will cause this ejaculation. Got it? Now here what happens to the female reproductive system? The most of the changes will take place in the uterus. Now the tricky portion that we already seen in our previous slide of male reproductive system, the female reproductive system is even more trickier. Let's understand that. So as far as the uterus is concerned, there are two type of uterus. Yes, two type of uterus. One, the uterus is pregnant. Another uterus, the uterus is non-pregnant. Let's discuss a non-pregnant uterus first. Now what happens to the non-pregnant uterus? Now non-pregnant uterus, whenever there is a sympathetic overactivity, that sympathetic overflow basically occur during sex. Now during sexual intercourse, whenever the sympathetic overactivity occur, uterus will contract rhythmically to suck semen. Again peristaltic type of contraction will seen, but in the reverse order. So in order to contract the uterus and rhythmically, we have to stimulate certain smooth muscle that is present over the uterus. So the uterus of non-pregnant lady having a alpha 1 receptor in order to contract the uterine smooth muscle, right? So in non-pregnant uterus, the gene for alpha 1 receptor is stimulated. There are more active alpha gene that is responsible for formation of the alpha 1 receptor. Got it? This is all about the non-pregnant uterus. Let's repeat myself one more time. In non-pregnant uterus, whenever there is a sympathetic stimulation, uterus will contract. So the uterine smooth muscle having alpha 1 receptor. So the cell of the smooth muscle that is situated in non-pregnant uterus have a more active gene for synthesis of the alpha 1 receptor. Got it? Now what happens in pregnancy? Let's see what happens in pregnancy. Now during pregnancy, there is an increased amount of estrogen and progesterone. Right? During pregnancy, there is more amount of the sex steroid, estrogen and progesterone. Now once estrogen and progesterone is more, once the smooth muscle of uterus get exposed to higher amount of the estrogen and progesterone, the gene for alpha 1 receptor, a gene that is responsible for alpha 1 receptor, gets suppressed, while on the other hand gene for beta 2 receptor gets stimulated. So this is what changes the pregnant uterus from the non-pregnant uterus. In non-pregnant uterus, there are more active alpha 1 receptor, while in case of pregnant uterus, there are more active beta 2 receptor. So in pregnant uterus, in pregnancy, whenever there is a sympathetic stimulation, that sympathetic stimulation will ultimately relax the uterus. While in case of non-pregnant uterus, whenever there is sympathetic stimulation, it will ultimately contract the uterus. Now this is a very protective mechanism. By changing the number of receptor that is present, sympathetic stimulation will eventually prevent the termination of the pregnancy. See, if that thing not happen, if the beta 2 receptor not increase in pregnancy and alpha 1 receptor is not decrease during pregnancy, what will happen? Whenever there is sympathetic stimulation, alpha 1 receptor get activated and it causes contraction of the uterine smooth muscle and fetus will ultimately expulse. Right? There is a premature labor will occur. The child will birth prematurely. Right? We do not want that. The nature play a very important role. It make a very beautiful system over here. Once the lady is non-pregnant, sympathetic stimulation causes contraction of the uterus and it will suck the semen and increase the chances of to get pregnant. Once the lady get pregnant, it causes changes in the receptor. Alpha 1 receptor get decrease, beta 2 receptor get increase, and ultimately whenever sympathetic stimulation, uterus get relaxed and prevent the termination of the pregnancy. Got it? So basically this mechanism used in pharmacology, the sympathetic stimulator is used to prevent the premature labor. If the lady complaining about the labor pain prematurely in 7 to 8 months, then the gynecologist will introduce or it will inject a drug. That drug is the sympathetic stimulator. This sympathetic stimulator is work via this beta 2 receptor and ultimately the pregnancy terminate the earlier terminate the premature labor, and the name of the drug is Reproductive. Alright, now let's take a look into the applied aspect, pheochromocytoma. Now what is pheochromocytoma? Pheochromocytoma is basically the tumor of the adrenal gland. There is a hyperplasia of the chromaffin cell. That chromaffin cell is basically secrete the epinephrine. So basically in pheochromocytoma, very high concentration of the epinephrine and norepinephrine will occur. Now what are the clinical features of the pheochromocytoma? Let's enumerate one by one. There is a sustained hypertension. Remember the H in this hypertension. Palpitation, the P. Hyperglycemia. Then headache. Extreme tachycardia, increased heart rate. Episodic sweating and increased metabolic rate. Now in order to remember the clinical features of the pheochromocytoma, remember the spelling. It starts from PHE. Got it? This P stands for palpitation, H stands for hypertension and hyperglycemia, E stands for episodic sweating and tachycardia. It's a little mnemonic to remember the clinical feature of the pheochromocytoma. So what happened in pheochromocytoma? Basically very high concentration of the epinephrine and norepinephrine. So obviously there are higher amount of metabolism of epinephrine and norepinephrine. So the metabolic end product will also increase. So diagnosis of the pheochromocytoma will done by urinary excretion of the metanephrine and the VMA, vanillin mandelic acid. Got it? And the treatment of the pheochromocytoma is simply surgical removal of the tumor. Got it? This is all about our today's lecture of the adrenal medulla. Next time, in next lecture, we are starting the adrenal cortex. Thank you.